Okay, we are just after 1 minute past 11. Not too bad for us normally on a start. We're running a couple of minutes late. I'll let people in as we start. If I can, I'm taking over today. Louise is not available at the moment, so I've stepped in for this. So I will just do a very quick introduction, and if I could just ask everyone if you can put yourselves on mute, unless you're going to be speaking. If you need to speak, ask any questions later on, if you can use the reaction buttons and put your hand up or wave frantically on the screen, and I'll keep an eye out for people who are using that. And I think we're almost ready to go. Thank you all for coming along today. This session is going to be looking at the virtual consultation proposals for Halton Hospital Outpatient Services, which will be at Runcorn Shopping City. We've got Lucy Gardner from WHH, Warrington Halton Hospitals, who's come along today, and I'm sure we'll give you an update on everything that's happening. If I hand over to Lucy, I'm sure she'll fill it in, and if please just wait until if Lucy's happy with it, wait till the end of the presentation to ask any questions, and we'll cover it on then. Thank you very much. Over to you, Lucy.
That's great. Thank you so much, Dave. Thank you so much for inviting me to join you today. So my name is Lucy Gardner, and I'm the Director of Strategy for Warrington and Halton Hospitals. And as Dave said, I've been invited today just to share with you the virtual consultation proposals for the provision of some hospital outpatient services at Runcorn Shopping City. I'm ably assisted by Viv Risk, who's one of our project team on this programme of work, and who will also be helping me out with some slides. So could I have the next slide, please, Viv? So some of you may have already seen the pre-consultation engagement work that we did in terms of these proposals. And so the purpose of today really, and a number of other sessions like this that we have been running over the past few weeks, is to build on the feedback that we had through the pre-consultation engagement and to formally consult with members of the public on the proposed provision of 3 outpatient services from a brand new purpose-built health hub in Runcorn Shopping City. So the purpose of today really then, to provide you with a bit of information on the proposed provision of those services, explain why we are proposing this, and also give you an opportunity to ask any questions or share any feedback. Could I have the next slide, please? So we'll just briefly cover the vision and the aims of the project and the proposals, the results that we've already had from the pre-consultation engagement work that we've done with members of the public, a little bit about why would we provide outpatient hospital services from Runcorn Shopping City, a bit more information on the services, some of the progress to date in terms of the development of these proposals, and the proposed future timeline, and then, as I say, an opportunity to ask any questions and to share with us any feedback that you have. And if questions do come to you as we're going through, please feel free to pop them in the chat, and we can pick them up at the end, as well as having the opportunity for you to all speak at the end too. Thank you. Can I have the next slide, please? So that's me. And normally on this slide, for some of the sessions that we've done outside, we've also had some members of the services sharing some of the detail around their services. Unfortunately, they are currently in clinic, so they're unable to join us today, but they've provided some of the information that's included within these slides that I will share with you. Can I have the next slide, please, Viv? Thank you. So I guess, where did this kind of come from in the first place? Why would we look to deliver services from Runcorn Shopping City? So the first point really is around making sure that we are providing healthcare services closer to the community and in more convenient locations, which is also very much in line with the national healthcare strategy. And indeed, you might have seen recently on the news that there is now even more specifically a real focus on providing healthcare within retail areas, within town centres and shopping centres. So in that sense, we're kind of a little bit ahead of the national guidance and strategy, which is great. It's also really important in terms of supporting our local community assets. So again, many of you will be really familiar that even kind of pre-COVID, some of our high streets and shopping centres were struggling, and that's been exacerbated really by COVID. And it's obviously really important to us that we're able to retain our shopping centres and town centres. Do you know, they bring employment, for example, and help the economy in the communities that we serve. So by bringing some health services into Runcorn Shopping City, we hope that we would be able to support the sustainability of Shopping City itself in terms of bringing more people into Shopping City, in turn kind of accessing the retail offer and supporting jobs within the retail sector in Halton, which will be really important for the future. The proposals also support our plans to further develop the Halton Hospital site as an elective hub. So over the last few months, we've been able to provide additional services from Halton Hospital that we haven't been able to do previously. So we've moved, for example, some elective surgery for Halton residents that was previously unavailable on the Halton site onto the Halton site, and we've been able to do that because we've established a new kind of post-surgery enhanced unit. So not quite an ITU, but means that we're able to operate on more complex patients who require just a little bit of additional care over and above a normal ward, kind of on the Halton site, which is a massive development. And by freeing up more space on the Halton site, these proposals allow us to continue to extend on that new provision in the Halton Hospital site, which in turn support the plans for the future of the hospital site, where we would intend to include that elective hub provision in new facilities in the future. The proposals also really help to support COVID recovery. So again, I think people will be really familiar of the really unfortunate national position that we have in terms of increased waits for many health services, given the impact of COVID. And these proposals allow us to provide an additional 3,000 appointments per year, so to really help to reduce those waits that have built up, particularly over the last 18 months. They would also enable us to provide expanded ophthalmology and audiology services, which again will help to reduce waiting times. Can I have the next slide, please, Viv? Thank you. So I just wanted to share with you some of the feedback that we've had so far in the work that we did with the public, kind of in this informal kind of pre-consultation engagement exercise. So this ran from the 25th of February to the 17th of March of this year, and people were able to offer their views via a variety of methods, so via an online survey, a paper survey, and via virtual presentations like this one. And we had an absolutely fantastic response in terms of 315 people formally responded via the surveys. And 56% of those people that responded had used at least one of those 3 services that we're proposing to provide within Shopping City, provided by the Trust. 51% felt they'd been given enough information to form an opinion. This is kind of helpful to inform what more we need to do via the formal consultations. So via the pre-consultation engagement, we provided a really detailed booklet kind of describing the changes with some frequently asked questions, and we further expanded on that for this formal consultation exercise, and that is available on our website. And we've also been sharing hard copies with existing patients and via sessions that we've held in person, both at the hospital sites and in Runcorn Shopping City itself. 64% of people who responded said that they had been made aware of the proposed changes. Could I have the next slide, please? Thanks, Viv. So over 50% of the respondents supported the change, and 13% somewhat supported the proposed changes. 32% at that time did not support the changes, and less than 5% were just a bit unsure as to whether they did support the changes or not at that stage. And I guess that's another reason for doing that pre-consultation engagement, so we can understand what it is that people need to know more about in order to form an opinion. Could I have the next slide, please, Viv? So this slide I think is really important because this describes the percentage of people who responded who would be willing to have their appointments for the 3 services that we're planning to provide at Runcorn Shopping City, whether they would be happy to have their appointments at Runcorn Shopping City. And you can see that was between 69 and 70% for each of those services. So ophthalmology, audiology and dietetics. So that's a really positive result, and that's reflected really in some of the conversations that we've been having with members of the public over the last few weeks out in Shopping City and in the hospital sites, where people have been very supportive of the provision of services within Shopping City, and often, to be honest, asked about other services and whether they would be available as well, in addition to the ophthalmology, audiology and dietetics provision that we're planning. Can I have the next slide, please, Viv? So I think we've probably covered much of this in terms of why we would plan to provide help in Shopping City. So we talked a little bit before about the importance of a high street location, both in terms of it's really accessible for members of the public, which is further enhanced by the fact it has free parking and also really good public transport links to Shopping City. And then I referenced before kind of the wider impact in terms of supporting that kind of footfall into Shopping City, and hopefully then people accessing the retail offer as well, and in turn kind of supporting economic regeneration. So one of the other key points is that Shopping City is separate from the hospital site. So as a hospital trust, we work really hard to separate wherever we can what we call planned activity from unplanned activity. So planned activity where people have an appointment or they're accessing care in a non-emergency situation versus unplanned activity where we have people accessing emergency care. And kind of really helpful to separate those two for a number of reasons. One of the key ones, which again has been highlighted by COVID, is to reduce the risk of infection. Because for those people who are attending for an emergency, you know, it may be that they have an infection that isn't identified until they're assessed. So key that we try where possible to keep those people separate from those that are attending in a non-emergency situation. And therefore, by providing non-emergency services on a site separate to the hospital, it really helps us to do that and to minimise any risk of infection. It also helps to make sure that those services are not impacted should there be a need to increase, for example, emergency provision, again, something that we've seen really highlighted over the last 18 months. And then, as I mentioned earlier, it kind of will help us to free up some space on the hospital site to continue to bring across new services as we have done over the last kind of 12 months or so. One of the final things to mention about the space that we've identified in Shopping City is that there is room for further expansion, which kind of links to what I was saying just before around some of the feedback that we've had so far is actually it would be really great to be able to access these services from Shopping City, but what about, and then people have named kind of individual services that are important to them. Kind of one of the overarching themes from that has been around maternity services, kind of in terms of pre and postnatal appointments is something that people have raised in the last few sessions where we've been talking to the public. Could I have the next slide, please, Viv? Thank you. So just a little bit now then about which services we are hoping to provide from Runcorn Shopping City. So there are 3 services, ophthalmology, audiology and dietetics. And there's a slide on each of those coming up, which I'll talk through in a little bit more detail. But first to mention that there will be no services lost. No services lost. And in particular, I think we had some concerns raised during the initial pre-consultation engagement that people were worried that this would mean that services would be lost from Warrington Hospital. That is absolutely not the case. And in fact, in the case of audiology and ophthalmology, the proposals will include an expansion of services. Could I have the next slide, please, Viv? Thank you. So I apologise that Sonia, who is our ophthalmology lead and is absolutely brilliant, isn't here to present this slide. And if you have questions on this one, I shall do my absolute best to answer them, but I will also be able to take anything back to Sonia. who is really excited about the opportunity to provide ophthalmology services within Shopping City. And you can see here just a summary of the clinics that we are proposing to provide within Shopping City. So there are 2 different types of paediatric clinics, so orthoptic and optometry clinics, and also paediatric visual processing clinics. And the paediatric visual processing clinics, it is proposed that they would move over from Halton Hospital, whereas the orthoptic and optometry clinics are an expansion of services that are currently available on our Warrington site, and Halton residents would currently travel for those out of borough, which these proposals would mean that they would not no longer need to do. From an adult perspective, we're proposing to provide glaucoma assessment clinics, cataract pre and post-operative clinics, and ophthalmic primary care clinics. Also, neuro-ophthalmology clinics, which currently are also only provided at Warrington Hospital. So that again would give patients the opportunity to access services much more locally. And also potentially a new service, which you can see, I am going to say this, it's a bit of a difficult one, hydroxychloroquine screening service, which is a new service to the trust that we are proposing to provide within Runcorn Shopping City. And for ophthalmology alone, the proposals would result in over 2,500 additional appointments per year. Really important in terms of reducing the waits for some of those services that are described on that slide. Could I have the next slide, please? So audiology, predominantly the services that we're proposing to provide within Shopping City are hearing aid assessment, fitting and repair services. So they fit perfectly in a retail environment, really, because they're kind of regular appointments that people have to have, and also some historically we have had some longer waits for some of these appointments, so it would enable us to reduce some of the waits for these appointments by expanding the number of hearing aid assessment, fitting, repair appointments by over 600 additional appointments a year. This service is currently provided at Halton Hospital, and the proposal for Shopping City would be an expansion of that current service. Could I have the next slide, please? And then finally, dietetics. So the proposal is to co-locate clinics that are currently provided across 2 different locations for dietetics. So currently we provide dietetics clinics at Halton Hospital and from the St Paul's Health Centre, and the plan would be to provide 2 paediatric clinics and 5 adult clinics together within Runcorn Shopping City, instead of those clinics being provided at Halton Hospital and St Paul's Health Centre. And you can see just a little bit of detail there on the slide in terms of the types of assessments and services that would be available within those clinics. So for example, for children and families, focusing on allergies and growth delays, and then for adults, dietary advice to support with conditions such as celiac disease and diabetes. Again, really important given kind of the proportion of diabetes within our community, that we're able to make that as accessible as possible. Could I have the next slide, please? So just some key points to summarise in terms of the proposed service provision. So there will be no loss of services, and staff, the services that we're proposing to provide within Shopping City will be provided by the staff that currently provide the services. So absolutely continuity of care in terms of people who've built relationships with our staff. They will be NHS staff and the current staff that do provide those services. It will enable us to, as I mentioned, kind of relocate some space within Halton Hospital to further expand the offer within Halton Hospital, building on what we've done over the last kind of 6 months in terms of expanding our surgical offer on the Halton Hospital site. Services will be expanded in terms of ophthalmology and audiology, so an additional at least 3,000 appointments a year. And there are some services that through that will be provided in Halton that currently are only available in Warrington, in both ophthalmology and audiology. Could I have the next slide, please? So just in terms of progress to date, where we're up to, so back in July 2019, Halton Borough Council secured £1 million from the Liverpool City Region Town Centre Fund. Now, this Town Centre Fund is a national fund that's designed to kind of help regenerate and really preserve town centres and shopping centres. And we've worked as a hospital trust really closely with Halton Borough Council to be able to secure a proportion of that £1 million, so £350,000, to develop this health hub within Runcorn Shopping City. We've worked really, really closely and in a lot of detail with a range of clinical teams to help to identify which would be the most suitable services for provision in Shopping City. And you can see that those that we've described today are services that fit really well kind of within a shopping centre, because they are services that a lot of people access and that some people access quite regularly, and that people would be able to access them kind of whilst out doing their shopping, for example. Each of those clinical services have then completed really detailed service specifications. So this is kind of what would they need in order to be able to provide their services within Runcorn Shopping City. And that has included, for example, investment in significant equipment that's required. We've also been negotiating with the owners of Shopping City in terms of leasing space, and those negotiations are in progress. And then we've been working with the services and with the feedback that we've had from members of the public to look at what the space will actually look and feel like. And we've been working really closely with local designers to design that space. And we'll of course be able to incorporate into those final designs any further feedback that we get through this consultation. And then finally, the pre-consultation engagement results have been published, and those are the ones that I've shared with you earlier on in this presentation. Could I have the next slide, please? So just in terms of timeline and next steps, excuse me, it's quite hard to talk continuously for this one. We're currently in the public consultation phase, and today forms part of that public consultation. And that is running throughout May and is due to finish in the middle of June, so the 18th of June. And then we would plan to begin construction in this summer with a proposed go live date, so proposed opening of the services in maybe more like October time now, but September or October of this year. So in terms of next steps then, this now or over the next couple of weeks is your opportunity really to share with us any views that you have and your feedback on the plans, and we will then be able to make sure that all the feedback that we receive via the public consultation is incorporated into the plans going forwards. Next slide, please, thank you. And this is my final slide, you'll be pleased to know. So you can, this just gives you a sense of other ways that you're able to provide feedback, but also we're able to do that within today's meeting. So if you'd like to, you can complete our survey online up until the 18th of June. And there's a link there on screen. That link is also available on our website. Also on our website is a really helpful information booklet, which provides lots of the detail that I've shared with you today, but also further information on the proposals and some frequently asked questions. And that's in the About Us section on our website. You can also contact us via post, phone, or email, and each of the addresses and details are on your screen now. But I am going to pause there and just see if there are any comments or questions. Thank you so much for giving me the time to share all that information with you.
Thank you, Lucy. I can see Diane's hand has shot up for the first question. Diane, over to you.
Right, thank you very much, Lucy, for the presentation. I've got a few questions for you. First one is, if you're going to provide 3,000 more extra sessions, are you going to be employing extra people to provide these sessions? That's the first one. Warrington Halton Hospital appear to be going a full circle here, because we did have a high dependency unit in Halton Hospital about, must have been about 20 years ago, because I know, because the staff in there saved my life. And it was taken out of the hospital by Warrington and decided it was no longer necessary, much to the consternation of the people who live in Runcorn. I live in Widnes, by the way. Another question is, could we see details of the feedback you've had so far? And how have you got any feedback from people who aren't digitally connected, so that they don't have internet access, they don't look on social media, etc.? Because there's quite a lot of the population in Halton don't have the facilities for that, and I'd hate for them to be excluded from this. Sorry, there's a barrage of questions as usual from me.
That's okay, Diane. When you started speaking, I immediately got my pen because I thought I'm not going to be able to remember them all at once. So I've written them all down. Thanks, Diane. So in terms of the first one around, are we employing more staff for the 3,000 additional appointments? So both audiology and ophthalmology have reviewed kind of what they are able to accommodate within their existing staff that they already have, and whether they need any additional staff. And where they've needed it, they have been able to appoint additional staff within their budgets. So we've not, it's not an expansion in terms of we haven't had any business cases from a revenue perspective, you know, so we've not invested additional funding, but there is, because there is funding within their budgets in terms of the additional staff that they need within ophthalmology and audiology. Now, I couldn't tell you exactly what that is in terms of what they've, how they've changed their staffing models, but I know that they have the staff that they need to deliver the additional 3,000 appointments with what they've been able to do, either within their own budgets that are already allocated. In terms of the going full circle, so I think that was more of a comment rather than a question, but I'll just expand a little bit in terms of the new unit that's in place. So it's called a PACU, so a post-anaesthetic care unit. So it's not as high dependency as an HDU unit. What it does mean is that we are able to operate on more complex patients on the Halton site who previously would have had to have gone to the Warrington site. So it does mean that we've been able to expand our elective surgery offer. And what we've also done over the last 12 months is expand the specialties that are offered within what is now the Captain Sir Tom Moore building to be over and above orthopaedics. So that's been really positive, a real positive move for Halton residents. I couldn't comment on the history, Diane. I'm sure you know that much better than us. But what I do know is that it's a real positive now in terms of being able to expand that provision in Halton. And I think what's really important as well for the future is that Halton is really well placed to provide that kind of elective hub service, not just for Halton residents, but for a wider geography, because we know that within Cheshire and Merseyside, there's a real demand for having separate elective care sites. So if I just use kind of perhaps some of the central Liverpool, and this is quite common in kind of city centre hospitals, one of the real challenges that they have is that if they have a surge in emergency care, it often means that they're unable to provide the same number of elective surgical procedures, because that the emergency care surges have an impact. And therefore, by separating out elective care onto dedicated sites, we're able to make sure that we can continue with the same volumes of elective care and helps keep the weights down in elective care. So there's a real opportunity for Halton in the future to expand even further on what we've been able to expand within the last 12 months.
Can I just question that? Over the last, I'd say, 25 years, Warrington Hospital appeared to have run down Halton Hospital. I worked there for a time. I was in radiology, so I know that part of the service. And it's been a gradual running down of the service. And now it appears you want to put some of these services back in. I wonder whether it's going to be permanently or it's going to happen again, that they're going to be whizzed out again. This is just questions I've been asked from residents of Runcorn who are quite worried about what has happened in the past, and they can see it happening again.
Thanks, Diane. So in terms of our plans, so there are no plans to take services back that have been put into Halton Hospital, and our plans definitely are to continue to build on what we've done already in the last 12 months in terms of creating an elective hub within Halton Hospital. So there are no plans to remove services, and indeed there are plans to continue to build on that service provision in Halton. Does that answer your question, Diane? Should I? Oh, Diane, you're on mute, sorry.
Sorry, it's the last piece regarding details of the feedback you've had so far. Could you possibly share those with the members of this meeting, please? Through Health Watch, obviously.
Yeah, so Diane, just a quick question, because that's what this presentation intended to do. What further detail would you like? Well,
the details of what people of Halton have said to you so far, because we are unaware of what's been said to you, and I'd just like to see the details, that's all.
Okay, so Viv, could you just pop back to the slides in terms of the outcomes of the pre-consultation engagement? So they're summarised within here, Diane, and what we do have is a little bit more of a detailed presentation that we've shared which we'll be sharing with Health Scrutiny and Health and Wellbeing boards, which we can share with you as well, which provides a little bit more detail than what you can see here in terms of the pre-consultation engagement results. But this here was a summary of that in terms of the number of responses we've had. We've also got things like demographic details of all of those people that responded, some of the key themes. So perhaps we could share the presentation that's going to Health Scrutiny and the Health and Wellbeing board. Would that be helpful?
That'd be really helpful, Lucy, if you can send it. I think
Yeah.
it's most probably just a matter of trying to spot what the other stats are. You've got the figures about how many people are willing to have an appointment to the shopping city, but maybe some of the reasons why there's maybe 30% who aren't willing to have it. What are you looking at the reasons that people don't want to use at the moment? Could I just ask one question on that? If somebody at the moment uses Warrington Hospital for these services and they live in Halton, they can carry on using Warrington Hospital if they wish, can't we? We don't have to use the new ones, so the option is still there. But yeah, if you've got a more detailed presentation on it, we'll make sure that gets out to everybody who's at the meeting today.
Great, thank you, Dave.
Thank you.
And then Diane, you had one final part of that question, which was around how are people who are not digitally connected able to provide their views. So we have run a number of face-to-face sessions, both in terms of in Warrington Hospital, in Halton Hospital, in the Captain Sir Tom Moore building, in Runcorn Shopping City, a number of different sessions where we've been directly talking to people. Some people have then filled in, at those sessions, have filled in hard copies of the questionnaires. Some people have asked for support in filling them in, which we've given in terms of directly helping people to complete those at those face-to-face sessions. So hopefully that answers that bit of your question as well.
Just while you're talking about the slide with the results on, the first result says over 50% support. Can I ask, was that just over 50 or is it nearer to 60? I couldn't understand why that one said a rough figure like over 50, but everything else was quite specific.
Thanks, Diane. It will be just over 50 because if we add the others up, so we've got like 82, 95, it's probably almost, yeah, just over 50. I'm just doing the quick maths myself on the slide, so bear with me, but yeah, it's just over 50. But all of that will be in the detailed presentation, Diane, which we'll share.
Sorry, that was actually Maureen that
oh, sorry, Maureen.
But
sorry, I couldn't see you there, Maureen.
I'd like to have shared as well the paper copies. I know you have to take out the patient details, but we need to know how many people you've spoken to, please, and what was the percentage of yeses and nos for that? I'd appreciate that. Thank you.
These results, Diane, include those paper copies. So include all the paper copies from...
Sorry, I mean the percentage of people you spoke to by a paper as to the people you spoke to via digitally.
Okay.
Yeah, that's that percentage as well. I would appreciate that as well. I like figures.
No problem, Diane, that will be fine. We'll be able to do that for the pre-consultation engagement, and then obviously the consultation itself is still in progress. So at the end of the consultation, we'll then provide another set of figures that will be the consultation results. So at the moment we have the pre-consultation engagement results, and then following the completion of the consultation at from the 18th of this month, we'll then have a similar set of figures for the consultation itself, which we can share as well at that point.
Okay, thank you, Lucy.
Thank you.
Before go, I can see a couple of hands up, but there's also a question in the chat from Lorna, just asking, will it cost Warrington Halton Hospitals more money in terms of lease contracts with coming away from a hospital where there's already plenty of unused space? I see this empty space as a patient currently. So that's a question.
Thank you, Lorna. So there will be a cost in terms of service charges, but that is a cost that we are already incurring in terms of servicing our own estate. So there will be a cost. The revenue cost is pretty minimal. I obviously can't really share the details of that, it's a bit commercially sensitive in terms of the lease negotiations with Shopping City, but there is of course a cost to that. There's ultimately a benefit to that from the organisation's perspective, because it frees up that space for us to provide those extended planned surgical activities, for example, that we talked about within the presentation. But yes, there will be a cost.
Okay, there's a couple of hands up, if well, 3 now in total. If we could go to Paul first, then Irene, and then back to Diane. So over to you, Paul.
Hi, Lucy. Thanks very much for the presentation. I really appreciate the lengths you're going to do a proper engagement. It's good to see a pre-consultation and a consultation. Those are not usually done. What I find interesting when you do a consultation, it's not always the positive answers that you need to look at. You've got a 32% sort of negative sort of approach to it. I wondered, when you were looking at those responses, what areas were there, and have you taken them on board and implemented any changes to answer them?
Thanks, Paul. That's a really good question. So I think a lot of the concerns that we've kind of grouped together themes of the concerns, and a lot of them probably are due to not quite a full understanding of the proposals. So concerns around services being lost from Warrington, which is not the case. Some concerns around kind of parking. We always get some concerns around parking, and around access to Shopping City. So what we've tried to do is take into account all of the different concerns that we've had and made sure we've provided additional information through the now formal consultation. It's actually, like I say, it's quite unusual, isn't it? But it's actually been really helpful, I think, doing the pre-consultation engagement, because it's kind of helped us to understand where perhaps some of the information that we were supplying wasn't clear enough. But predominantly the concerns have been around things that are actually something that probably doesn't need to be a concern. So I'd say the two main ones were around access and parking at Shopping City, loss of services from Warrington, and there was a little bit of a theme around would we be providing the same in Widnes as well as Runcorn, which is probably the one that's most difficult for us to address, because at the moment we don't have any plans to do that, but the others can be addressed relatively straightforwardly within the updated information.
Right, thanks, Lucy. That's good answers. Thank you.
Thank you. If we can move to Irene next, please.
Hi, Lucy. My question is, we have a more diverse population in Halton now. You know, we have quite a few refugees who struggle to access services at the best of times. Did your consultation take this into account? And will interpreting services be available at the point of service delivery when it goes into the shopping city? You know, given the duties on the Equality Duty Act. There are a number of groups that you can access for their opinions. If you'd like me to share them with you, that's fine. I just wanted to know that because I think it's important that everyone has a voice and that they do understand the system.
I completely agree, Irene. I think that's another really, really great question. Thank you. So we have offered translation of all of the consultation materials into other languages. I'll check with Viv in a second, but I don't think we've had anyone who has requested that. Through some of the face-to-face sessions, I think that's helped us to be able to access a wider variety of individuals. We will be able to, so with all of our services, we're able to provide interpretation, and we will be able to do that through the services at Runcorn Shopping City. That would remain unchanged. If there are specific groups, Irene, that you have links into, that it would be helpful to share these details, then please do. Really appreciate your support with that, because as you say, the wider that we can engage, absolutely the better. Mm-hmm. In the detailed presentation that we'll share with Health and Wellbeing Board and Scrutiny, and which we'll also share now with this group, it does detail kind of some of the demographic information about the respondents that we've had, so you'll be able to see the breakdown, for example, in terms of different ethnic groups. But as always, I think we find in Warrington and Halton, we do typically have a much larger response rate from white people in the community. So anything we can do to further that reach, Irene, really welcome your support. Thank you.
I think it's so important because a lot of the Syrian families do not use the shopping city. They tend to go into Liverpool for all the halal food. There are groups, and I'll share the groups with you and the contact.
That would be great, Irene. Thank you. That would be brilliant.
Okay, thank you.
Thank you. And Diane next, and then we got Paul again.
Hello, yes, it's me again. I realise you said that the amount of rent being paid to a private company is commercially sensitive, but I do believe that the public should know how much NHS money is being diverted to a private company for rent, for providing services. I know it's commercially sensitive, but this is public money that's being spent.
Thanks, Diane. Diane, we haven't actually finished negotiating that yet, which is why it's commercially sensitive. So the negotiations are not complete. So I genuinely can't answer that question at this moment in time. And the reason why I can't share it is because that would hinder the negotiations, and obviously we want to get absolute best value for our NHS money. So I genuinely can't share that at this moment in time. I'm sure that post those negotiations that will be possible once we've got a confirmed contract, but at this moment in time we're unable to do that.
Yes, I do understand that. I do understand that. But I do think we should know, once the negotiations are over, is how much money is being diverted away from the hospital building to a private commercial building. I
think, Diane, also it's important to think about the kind of long-term future as well, because what that, if we can provide services in a community setting that is more accessible to patients, then that might prevent us from having to build an even bigger extension, to the hospital in the future, which would cost a lot more money that would go to a private provider. So we also kind of need to consider the kind of longer term impact in terms of how much NHS money we are spending on new buildings and on that will ultimately go to private organisations. So part of this is also about getting best value from our NHS money. So once we've finished negotiating, I'll check, but hopefully we'll be able to share that detail at that point.
Thank you.
Thanks, Diane.
Over to Paul.
Yeah, I just imagine that after you've done the negotiations, we'll be able to see the overall, well, savings maybe of the negotiation and of going forward with the services. A question I've got really, it's just, I'm wondering which services, extra services you're looking at, Lucy, to be provided in the Shopping City offices. And just another quick one, what the heck's hydrochloroquine? I've never heard of it before. I
knew someone was going to ask me that, Paul. I might have to get some help on the second question. In terms of the first question, in terms of any additional services, so at the moment we are definitely only planning in terms of ophthalmology, audiology and dietetics. What we'll do is then take into account the feedback that we've had around other services. So I know because of the people that I personally spoke to, you know, in terms of the consultation, but I'm conscious I was only there for a couple of hours, that maternity came up a lot. But what we'll be able to do once we've got all of the results in is kind of look at those as themes in terms of where other people said that there were services that they would find it really useful. But at this stage, it's just plans for the 3 services. But, you know, if there are other services that the public are saying it would be really helpful to provide from there, then we will absolutely consider that. And also kind of working with partners around whether there are any other services. So, for example, local community trust, GPs, charities, there are other services that other people would like to provide that kind of complementary that would be helpful as well for the public. So we're having some of those conversations with partners too. I honestly, now I did learn about this a while ago, but I cannot remember. I am going to ask whether, I'm not sure if Viv or Carl are on the phone, if either of them know the answer to this question, but if not, Paul, I shall get an answer from Sonia, who is absolutely the expert, and share that back on email in terms of the new service.
Don't worry about it, Lucy. Don't worry about it, Lucy. I can certainly Google it later. It's not a big problem.
I can give a very sort of broad idea. It's a medicine which can have quite, which can affect the eyes. So people who are on the medicine need regular screening. So it's just to enable people to have that screening.
Thank you. That's good.
Thanks, Viv. That was a nice, easy to understand answer for us all.
So can I just get a feeling for where you're going in the future, Lucy, with the Halton Hospital? I can feel some concerns about people thinking, are they going to be running it down? And I remember 2 years ago, David Parr went forward with a big hospital plan. I wondered, is this working in with that plan, or where is that plan up to, basically, is the question, I suppose.
Another great question, Paul, and that plan is really important to me on a personal level, not least because I've invested years of time in developing that plan and repeatedly bidding for funding for that plan. So we have an opportunity which we were hoping would be spring of this year. It's been delayed. We're not sure what the exact time frame for that is at the moment, but to bid again for national funding for the new hospital plans for both Warrington and Halton. And so we're eagerly awaiting for that process to be announced. It will be really competitive. So we know that there will be 8 organisations in the country that are selected for national funding for new hospitals. We are in a strong position because of all of the work that we've done. So we have got approved strategic outline cases. Now that might not sound like much, but for example, the new Halton Hospital strategic outline case is over 100 pages long and is really, really detailed in terms of the plans and the options for developing a new hospital on the Halton site. The preferred one of which is very much in line with those plans that David shared at those sessions a couple of years ago, which is essentially building around the Captain Sir Tom Moore building, so that we can accommodate everything that is already on the Halton Hospital site. And indeed, we've just updated the master plan for that so that we can make sure that we also accommodate the expanded service provision that I talked about earlier in terms of some of the surgical specialties, because we're conscious that quite a bit's changed since that original plan. So we're working really closely with MPs and all of our local partners, so that we've got really strong support. We've got approved strategic outline cases, so we are in a really good position. We're just kind of waiting for that process to be announced, and we fully intend to bid for national funding again. Obviously, there's a risk that we won't be successful. If that were to be the case, then we would intend to continue to keep those plans alive until such a time where there will be an opportunity to bid again, because it's such a significant amount of money that it's not money that we can fund ourselves as an organisation. So it's absolutely not gone away. It's just trying to secure funding, really.
Oh, good luck with that, really. Really, good luck.
Okay, Lucy, there's I'd seen Anne's hand pop up, but there's also a question come up in the text from Maureen, and I think I'll echo some of this. There were a number of concerns raised on Facebook about Halton Hospital, and if this was the start of steps being taken to reduce the use of a hospital. Maureen's put, I feel this needs to be clarified for the public. I know we'd seen quite a lot on, I think it was Mike Amesbury's Facebook comments after he'd mentioned the consultation was out. There was quite a lot of negativity around that. And I know we contacted the CCG to just say maybe somebody needs to sort of look at this and sort of look at the answers to some of the questions that were raised.
Thank you. So I'm sorry, I've not seen that on Facebook, but I think it probably, the response is just in line with everything else that we've just talked about, really. So there are absolutely no plans to degrade Halton Hospital, to reduce Halton Hospital. So the intention is, as I said, to continue to kind of increase the provision in Halton. And there's evidence of that in terms of the services that we've moved over in the last 12 months. So all the plans in terms of the strategic outline case that I just described for Halton New Hospital includes the provision of all of the services that are currently provided within Halton Hospital. So if we do move any services out, all that enables us to do is to move more services in, because all the plans are based on the current services that are provided in terms of that strategic outline case for a new hospital. So genuinely, there are no plans to remove services from Halton, and in fact, quite the reverse. So I shared a presentation actually with our local MPs in Halton probably a couple of months or so ago, because it actually feels like I kind of pinched the council strapline of it's all happening in Halton, because genuinely, from a Warrington Halton Hospitals perspective, it does genuinely feel like we are, well, and there's evidence to back it up, that we're investing quite significantly in Halton. So as well as the new PACU that I mentioned previously, we've just invested in a new clinical research unit in Halton that's opened, where we're currently running a vaccine trial. So genuinely really significant investment in the Halton site.
Okay, thank you. Anne was just going to answer the hydroxychloroquine question, but it's already been done. If you want to say anything else, Anne, feel free to pop up now, and we'll all listen with great interest. If there's nothing on that, I have. We made an offer when Carl gave the last presentation that when it's all up and running in the shopping city, we'd offered to come in and sort of gather feedback from people attending the clinics, just as I think we said at the time, a slightly independent view on speaking to people, how they're finding it, and the offer's still there, to get involved around any work on that once it's up and running in September or October. Just while you were mentioning all the things coming to Halton, I noticed that there is also the consultation that's out about the breast screening, which is looking, if it goes ahead, it will move into the Captain Sir Tom Moore building at Halton. So that's another, say, positive for the area. I don't know if you've got any quick update on that, or we can send the link out to the consultation on that. After this, if anybody's interested. One final thing I'd just say, Lucy, was there any chance that this current survey is run until the 18th of June, just allowing for the fact it's been half term and all the other things? Is there any option for it to run any longer, or is it just to the 18th of June for feedback?
There isn't, unfortunately, just because of the need to present then back to both scrutiny and health and wellbeing boards. So I don't think there is any opportunity to extend that deadline. So obviously people have had a significant opportunity given the pre-consultation engagement as well. So I'm really sorry, no. In terms of breast, I can give a really brief update on that. So we're at a similar point in terms of breast, in that we are now in the formal consultation phase, and it would be great, Dave, if you're happy to share that the link to that consultation as well. That would be fabulous. Yeah. So essentially, as you described, the plans from a breast perspective are to provide a dedicated breast unit within the Captain Sir Tom Moore building, which would incorporate predominantly breast assessment services, but as well as screening. So where patients have had screening and an abnormality has been located, the assessment service that patients would be referred to at that point would all be provided within the Captain Sir Tom Moore building in Halton. So that's the kind of main point of that proposal. And again, we are kind of out to public consultation and keen to get as many views as possible on that. We have shared, again, hard copy presentations with a number of people, including all of our existing patients, as well as kind of sharing that consultation on our website, and also having similar sessions to this on the breast consultation too.
Yeah, we have given that a push on social media so far, but we'll give it another pushing out through the various networks, and I think next week we'll just try and give a final push to get a few more responses in before the deadline of the 18th on this. A couple of hands went up again. I think it was just Irene before Diane. So Irene.
Lucy, you know the Survey Monkey, is that available in other languages? I know it's short timeline, but is it available in other languages?
Yes, we have made the offer that it can be available in other languages, absolutely. So if anyone does require that in a different language, then we'll be able to translate it.
Thank you. Thank you.
And Diane next.
Sorry, it's me again. You just mentioned about the breast, not for the screening, for the referral on if there's any abnormalities found. There's queries raised to me as well, but this was from people in Warrington who feel that they then will have to go to the Thomas More building and they will have costs incurred going across the Gateway or the Silver Jubilee Bridge. I know I'm from Halton, but as I said, radiology is my background, and I used to do mammography at Halton Hospital for them. So I just wonder whether you're going to get a bit of a backlash from Warrington residents over that.
Thanks, Diane. It's a really valid concern. So the challenge is that we have to consolidate assessment services in a single location, and that is in line with NHS England's kind of strategy, because as you'll know if you worked in mammography, it's really challenging in terms of we have a real shortage of mammographers nationally. And so nationally, there's a requirement to consolidate assessment services on fewer sites. So from a Warrington Halton, we serve Warrington Halton, St Helens and Knowsley from this perspective. And so we basically had a choice of, we need to consolidate assessment service on one site within that geography. And actually we have a slightly higher proportion of Halton residents accessing the assessment service than we do Warrington residents. and we also have significantly better estate within Halton. And in terms of those St Helens residents, it's also actually more accessible. So we've done quite a lot of work looking at all of the various travel times for people to inform that. And so Halton site really is the best location, but absolutely recognising that for Warrington residents, it does mean that they would have to travel a bit further than they currently do for that assessment service. So we've also asked people as part of the consultation kind of what's most important to them in terms of waiting times, access, outcomes, etc. And overwhelmingly so far, the things that people are most concerned about are the outcomes from their assessment service, and then the waiting times. So recognise it is a really valid concern, Diane, but it's almost one of those, it's like, we can't put it everywhere. So we've tried to look at where the best possible place is.
I take it that Widnes residents will still be able to use the Burnley breast unit at St Helens Hospital?
Yes, absolutely.
Yeah, because that was another thing that I was asked. Are they closing that? And I said I would ask.
No, and really importantly is that screening will still be available in all of the towns. So I think that's really important. So screening will absolutely still be available in Warrington, which is really important. And also the mobile screening unit will still be available in all of its current locations. Because that was a lot of the questions that we had through the pre-consultation engagement. So that's important to note.
Thank you.
Any more questions? Any more hands? No, I think you've answered it all, Lucy. Well done.
Apart from the one question that stumped me, sorry, Paul. Thank you so much for your time. And yes, if you do have any further questions or comments, then obviously all of the methods you can get in touch are on screen still. Yeah. But thank you so much, Dave, for inviting us. And thanks for your questions.
You're welcome, Lucy. Could we have a copy of the presentation? So just so we can send it out if anybody doesn't want to watch the whole of the video again on YouTube later in the week.
Yes, absolutely, Dave. We'll send that through to you. Thank you.
Okay. Well, thank you to everyone for coming along. I hope you enjoy the rest of your day. If you do have any more questions that you think of after this, please send them over to us and we'll get in touch with Lucy and try and get an answer for you. But in the meantime, if you know anybody who hasn't filled in the survey who would like to take part, give them a reminder. We've got just over the week on this one and a few weeks longer on the breast screening consultation that's out as well. Could we, Lucy, just dragging you back a bit, is there the possibility of having some sort of presentation on the breast screening one at some point? Maybe, about the service and what will be introduced, if you can fit that in, or if somebody can fit that in, it would be really helpful.
Absolutely. So we have actually got we're just finalising a date for a presentation around breast that will be open to everyone. So it might be, we can share that date with you, and if that works for you, then that would be fantastic. And if it doesn't, then we can probably organise an additional one. Does that sound okay? That
would be ideal. Thank you.
Okay, fab. Thank you so much.
Okay, thank you all. We'll see you at the next session we have, hopefully. Take care and have a good day.
Thank you, Lucy.
Bye-bye.
Thanks, bye.
Bye-bye.
Thank you.